When providers order medications, fluids, and other drugs, they need to go through the hospital's pharmacy. And many orders start their journey to the patient in a positive pressure room.
And what we do here is we manufacture products for the hospital.
Products made in the IV compounding room range from IV fluids to total parenteral nutrition or neonatal TPN and non-hazardous drugs for the infusion center.
Typical antibiotics or fluids that we have to get ready.
Across from the IV compounding room is the 800 room,
which is used for manufacturing hazardous drugs. That's things like chemotherapy. We have a couple other things. Sometimes they use formaldehyde.
Before they can start making the drugs, pharmacists have to go through the anteroom to prep and sterilize.
We put shoe covers on first. We then have to finger pick all of our fingernails to make sure there's nothing under. We do hand washing for 3 minutes. We don a hairnet, we put our garb on, and then we have to get gloves on.
Those working with hazardous drugs need to take a few extra steps before entering and exiting.
We put on double gowns. We have on double booties. We have scrubs on, face mask, goggles, headgear. And when we are getting ready to leave the chemotherapy room, we take off the outer pair of booties, so they're in the garbage, and we're on a clean side, taking them on the dirty side, taking them off, step over to the clean side. So we're not tracking anything from that room back in here.
A cleaner environment helps
protect the environment and to help protect all of the employees that are working here, including, you have to think about housekeeping coming in.
But a new setup doesn't mean the drugs will be produced in a shorter time.
The process takes longer, and I know that when somebody's in the chair waiting for their chemo, that it's a very stressful time. And, people start to get a little anxious, like what's taken so long.
From using biohazard bags to gearing up in gowns, gloves, and goggles.
There should never be contamination within when all of those steps are performed correctly.
For Arnot Health, I'm Lexi Cutmore.